This is the base view of the nose and the nostrils, as they're most commonly known. We call it the nasal vestibule, and it's basically the entrance way to the nose and where air first starts flowing. It's an important aspect of nasal breathing for a couple of different reasons. Statically, the nostril has to have a specific amount of opening in order for air to flow into it. This can be detrimented in a few different ways. One of the first ways is that sometimes the nasal ala actually are sunken in, such as this side, which leaves a very small opening right here for air to pass in. As you can see, rather than a large amount of airflow here, only a small amount can flow in here. That's going to cause a small passageway which can be affected in what's called the Bernoulli principle. If you think of a tube and air flowing through the tube, there's a nice laminar airflow. If you have this same tube, and in the same tube there's a stenosis, or an area of collapse, when air tries to come in, it all gets congregated in this one area. As it comes out on the other side, it becomes turbulent. This turbulence is what's going to cause the sensation of decreased airflow and also the actual decreased airflow. There's another aspect to this, that's this more of a static component, but another aspect is that there are cartilages that create this formation, as you can see right here. These are the lower lateral cartilages. These can become weak over time, or they can be patients can be born with a weakness. When we inspire, these cartilages are supposed to open. At times, some people have a collapse. So when they inspire, the nose collapses. You can see this just by tilting your nose up and looking in a mirror and inspiring both gently and aggressively. Along with the lower lateral cartilages, there are also upper lateral cartilages, illustrated in this video. These here are the lower lateral cartilages right here. There's also the upper lateral cartilage here. This can also create a dynamic collapse where upon inspiration there's a paradoxical movement. Instead of going out, they go in. You can also see that by just looking in the mirror. When that happens, many patients wear what's called a breathe right strip. So you'll see some athletes wearing these for performance, and people wear them at night to help prevent snoring. The reason why those help is they help keep these upper lateral cartilages open. The total nasal airway procedure addresses these along with other areas and can act as a permanent breathe right strip.